Good afternoon. Hello, everyone. Welcome to our COVID-19 update for December 17th. Pleased to be joined by Karen Gambino from Deaf Access Services, who will be providing the American Sign Language, and of course, Dr. Gail Burstein from our Department of Health, as we provide the latest on what is happening with regards to COVID-19. Have some good information to share and some not so great information to share. As of through December 15th, there were 34,131 unique COVID-19 cases in Erie County. The 7-day positivity rate has dropped to 6.1%. That's the lowest we've seen with regards to a 7-day rolling average in quite some time. Unfortunately, we've had 25 more people die as a result of COVID-19 through December 16th. Now, the number of those who've died as a result of COVID-19 is now 1,001. So we have crossed a very somber, sad barrier, which is the number of individuals who died in Erie County as a result of COVID-19. And I do want to offer my deepest condolences to the family and loved ones who've been lost, whether it was the first death or the most recent one. We understand that this has been a terrible year for you, and we offer our deepest sympathies to all who've lost a loved one during this terrible pandemic, whether it's actually someone in our own county or elsewhere. Hospitalizations, we see in hospitalizations that on the 15th, there were 527 COVID-19 patients in Western New York hospitals, 118 of them in the ICU. And on that day, 433 patients were in Erie County hospitals, 93 in the ICU, 66 on an airway assist, 5 died, and 38% of the patients on December 15th in an Erie County hospital were age 64 or younger. So it's not just those that are elderly that are in the hospital as a result of COVID-19. We have a little new data with regards to zip code and positivity rate for the week ending of December 12th. You can see on the left of your screen is raw new cases. We talked a little bit about this last time with also the positivity rates, but then we wanted to do a comparison of zip codes based on the percentage of positive in a zip code, with the highest being actually the Irving zip code, followed by Gowanda and Collins, some very high numbers of those who were tested. So we're seeing some exceptionally high numbers of positivity rates in our rural regions still, though if you go through that list, you will see that there are COVID cases everywhere, as we've talked about, urban, suburban, and rural, but the rural areas really seem to be getting hit hard. And I do know that there have been an increased number of hospitalizations of individuals who live in rural settings. So it does go to show that just because you're in a rural area, it doesn't mean that you are not going to catch it. It's out everywhere. Once again, this is the hospitalization numbers for Erie County from December 2nd to the 15th. And 76.7% of all beds on the 15th were occupied. This means that of the 100% of the beds, 76.7 were occupied. They weren't all COVID patients. Could have been a heart patient, could have been a kidney patient, lung patient, cancer patient. But we were up to a very high rate of utilization of our hospital beds. It started to drop a little bit. 21% of those hospitalized were in intensive care unit. That means they need a certain higher level of care, of course. And while hospitalizations have leveled off, they're still much higher than they were at our peak in the spring. So we, as a county and as a Western New York region, have done worse with regards to hospitalizations for individuals this fall and early winter than we did in the spring. I'll turn it over to Dr. Burstein now to talk a little bit about some of the information, the most recent information from the Western New York COVID-19 Analytics Work Group, which takes into account the most recent data to try to plot where we're going to be in the future as it pertains to hospitalizations. So, Dr. Burstein.
Good afternoon. So I'm going to talk about data that was put together by Dr. Peter Winkelstein from the Jacobs School of Medicine, who has a team that is working on predicting what will happen with our hospitalizations from as a result of COVID-19. So this graph is looking at our COVID-19 cases from the beginning of July up until where we were recently in the middle of December. looking at in blue, or in, I guess, aqua, our 7-day positivity rate of COVID-19 in the community, and then in yellow, looking at the census of COVID-19 in the hospital. So we are all familiar that what we've started to see at the end of October, beginning of November, a sharp increase in the number of COVID-19 cases that are reported in the community in Erie County, and then followed by about a week and a half later, we started to see an increase in the hospital admissions from COVID-19 in Erie County hospitals. So I want to call your attention to about the last week or so, where we've seen a kind of a flattening off in our 7-day positivity rate of COVID-19 in the community, where we've had more of a stable and even a slight decline in this 7-day positivity rate. And then followed by, also we're starting to see kind of a flattening off and hopefully a small decline, which will continue to trend in our COVID-19 hospital census. So we're hoping that as our positivity rate in the community, our rate of people who are diagnosed with COVID-19 in the community actually flattens out and even starts to decrease, that will affect our hospital census, and we'll continue to see either a flattening out of our census or hopefully a decline. Hopefully we'll see that persist. So now what we're looking at is Dr. Winkelstein's model, looking at hospital admissions in Erie County hospitals in the blue dots, and looking at the prediction of what the admissions, the census will be like in the hospital in the yellow lines, starting from the beginning of October. So you can see that with Dr. Winkelstein's model in the yellow line, our blue dots pretty well aligned, so the model has a very good match to what is actually happening with hospital admissions. And you can see that a couple weeks after Thanksgiving, we started to see a greater increase in the hospital admissions compared to what was expected, and we think maybe that might have been a little bit due to Thanksgiving. However, it's steadied out, and it looks like, and with the blue dots, we're heading back to the curve. So I just want to point out that but this curve doesn't show any additional interventions, no more yellow zones or orange zones or red zones. So this is what we would predict with if we just continue doing what we're doing. So the good news is that the curve is not as steep as we initially had anticipated. The bad news is that it does continue to increase and doesn't really seem to level off until sometime in January 2021. And that number looks like it's about 500. So I think the take-home messages from this is that we did have a small surge in hospital admissions as a result of Thanksgiving. However, it was nothing like what we had anticipated due to people getting together for Thanksgiving. So that meant that many people in the community were doing the right thing, and we were able to keep our numbers down in the community in terms of cases, and also keep our numbers down in the hospitals. We didn't see a surge in the hospital like they did in other parts of New York State and other parts of the United States. Also, we can see that the curve is still increasing, and we expect it to plateau according to Dr. Winkelstein's model in January, and that'll be at about 500. And remember, our ICU admissions so far have been about 20% of our total admissions. So that means we could expect our ICU admissions to be around 100, and that's getting very close to the scary number, if you recall, in the spring, in April, where we peaked at about 124 ICU admissions. So we're hopefully we won't get that close. One thing that Dr. Winkelstein did show in his model that I didn't show a picture of is that Dr. Winkelstein was able to look at our weather report in Erie County. And what he was able to show then, when we started to have a drop in temperatures, that was followed a couple weeks later by an increase in the number of COVID-19 cases in the community, and then followed by a sharp increase in the number of hospital admissions into our community. And so what we think happened is that, people were, doing a good job with gatherings outdoors and wearing masks, and, outdoor gatherings is a much less a risk for transmission than indoor gatherings. But when it's become very cold, especially like today when it's snowing, people aren't doing outdoor gatherings anymore. People are gathering indoors, and indoors gatherings is where we see transmission. So it's not just what we're doing, it's where we're doing it. So again, we have to be really conscious about what we're doing in the wintertime, because in general, we don't have the luxury of gathering outdoors with our friends, which is a much lower risk situation compared to what we did in the summer. So I'm going to turn it over to the county executive to talk about how we have been responding in Erie County.
Thank you, Doctor. Actually, we had a meeting of our business task force earlier today, virtually. A lot of information was shared with the local business community, including the latest information on unemployment data and the like. They've been working on a number of projects, starting with our Erie Grown, the Shop 716 program, the Back to Business program, a number of loan programs, which we'll talk about, including a new loan that offers up to $250,000 at exceptionally low interest from the ECIDA. So we had a good meeting earlier today, and I want to thank the members of the Business Task Force for the work that they've done. The Erie County Industrial Development Agency is pleased to announce that we have a COVID impact loan program. If your business has been negatively affected by COVID-19 restrictions or on commerce, and you need working capital, you may qualify for up to $250,000 low-interest loan, one-year loan program, in which the interest rate is 1%. It's basically free, but it is a loan. It's not a grant. And it is to assist companies and businesses that may need additional working capital and the like to get through this period. No payments for a year, interest-only payments for year two. There's a one-year loan program in total for the no payments. You can spread it out over a number of years. You can call 856-6525, extension 219 for application information, or go to the ECIDA's website at ecidany.com for more information. And I want to thank our partners at the Erie County Industrial Development Agency for their work in coming up with this loan program, and of course my colleagues at the ECIDA for the work that we do supporting local businesses in our community. We approved yesterday 2 major incentives to assist Thermo Fisher, a pharmaceuticals manufacturer on Grand Island, expand its operations in Grand Island with a $90 million investment, and Rosina Foods with a more than $50 million investment to expand their facilities in West Seneca. So we've been working very hard, and businesses are doing what they can to not only survive but thrive. And then on the Back to Business program, we've been talking all about it for some time now, to shop smart, shop safe, shop Erie County, keep those dollars local. Every dollar that's spent at a local business goes back into our economy. The Back to Business grant program, of course, delivered over $19 million in financial aid to nearly 1,400 businesses. 43 North has made some additional grants over the past 2 weeks due to some administrative and other marketing costs coming available. The grantees must spend their grant money by December 30th because it is part of the CARES Act, and it is required to be spent by December 30th. And a report on a program, including a full and final list of grant awardees, will be released in the upcoming weeks. As I said, 43 North just added some more parties, and I've not even seen the list myself. So we're waiting to see the final list, but I know a lot of parties have already received their money. I was actually at a couple establishments where they said they received grants, and they were very thankful for it because of the assistance it gave them to continue through these very difficult times. I was out shopping earlier this week. I'll be shopping some more locally. We want people to shop local, support Erie County. If you live elsewhere in Western New York, support your local retailers, because as we noted, that money goes back into our local economy. So as much as possible, Shop 716. I want to thank our partners with the Amherst Chamber of Commerce for the Shop 716 gift card. The e-gift card has been a rousing success. You can still buy gift cards and give them out to people, and they can be used next year. The free buy one, get one free gift card offer is over, but you can support and purchase additional gift cards and give them to people as gifts. Over 28,000 gift cards were purchased for a total value of over $1 million. which is all going to go back into our small businesses. So thank you for all who purchased a gift card. And remember, if you got a free gift card as part of it, it has to be used by December 30th, so get out there and do some shopping. Vaccine delivery, briefly, we do know vaccines have been delivered to area hospitals. The first Pfizer vaccine doses were received in the last couple of days and are being administered. They were delivered to hospitals, not counties. We do anticipate the first doses of the Moderna vaccine will be received next week once the official authorization has been provided by the FDA. And we think that may actually come by the end of this week or Monday of next week. I just want to remind everybody, as we talked about, vaccine will not be available to the general public for months. And here's something that hasn't necessarily been talked about, but as we were hearing from the scientific journals and the like, the vaccine may not prevent the spread of COVID, but it may protect you. Sounds like it'll protect you, but it may not prevent the spread. So you could catch it and theoretically pass it on to someone else. So we're still going to be need to wear masks for many months going forward, including even after you've gotten the vaccine. Still might need to wear masks because while you may yourself not get sick if you get the vaccine in the proper dosages, you could still theoretically catch the virus and then pass it on to others. It just won't have the effect on you where you're sick. So that is something that is still being looked into. And right now the evidence shows that while the vaccine is very effective to preventing you from getting sick, it may not be as effective with regards to prevention of transmission and spread. So we just need to keep on wearing our masks. And the Erie County Department of Health has set up a new web page with information on vaccines and will be updated as we get more information. It's at erie.gov/COVID19/vaccine. As we noted, it'll be several months before the general public has access to vaccines. We are working on our plan. We know that Catholic Health was chosen by New York State to be the hub for the upcoming phase 2 distribution, so to speak. Right now, the doses are being distributed directly to hospitals, but when they get into a larger distribution, it sounds like Catholic Health has been chosen as the reception point, but we know what others will be administering those doses. And of course, Erie County is continuing to update our vaccine distribution plan based on the information that's provided to us by New York State and the federal government. With that, I'll turn it over to Dr. Burstein to finish up and talk a lot about testing and some of the things to consider as we go through the holiday season.
Thank you. No worries, I got it. Oh, tall again. So I'm going to be talking about testing that we are still doing from the health department. So at the Erie County Health Department, we are testing individuals who live in Erie County that either are close contacts, so you should be in quarantine whether you have symptoms or not, and we would be able to test you with a polymerase chain reaction test, which is a very, very sensitive test. Or if people do have symptoms and they're not a close contacts, we can test people in our rapid testing program, which we are running actually 6 days a week. So to make an appointment for one of those tests, you can call 716-858-2929 to schedule an appointment. Remember, it's free. All you need is to show up and have an appointment. So we will have to turn people away if they don't have an appointment. And if you think that you're not going to be able to make your appointment, if you have one, please let us know because we are filling up very quickly and people really want to get tested. However, there are other places to get tested, and you can find that on our Erie County Health Department COVID-19 website at the COVID test sites. You click on a dot, and it'll tell you the name of the clinic, or the hours, or the pharmacy, the hours of, or the doctor's office, and the hours of operation, what tests that they do. If it's a place that is, not a typical place where they offer testing, say we know that, say it's a private provider's office or an office that doesn't usually offer testing, you really want to ask, first of all, that you're going to get a call by the ordering physician about your test results, and you also want to make sure that they are reporting their test result data into the New York State eClair system. Through our contact tracing testing work and notifying people about positivity, we have found that there are some places that aren't used to doing this type of testing that haven't been reporting to the New York State eClear system, and then we don't know about it, and we can't call people to notify them to ensure that they know that they're positive and put them in isolation, and then do a case investigation to find out who their contacts are. So that's, we know that, all the hospitals and the Erie County and the New York State and the urgent care centers and, the regular established primary care clinics, they're all doing a great job with testing and a great job reporting. However, and the pharmacies are also doing the same. However, if you're going to a place that isn't a typical tester that they just opened up, you just want to make sure you ask the right questions so you make sure that we know about you. Just talking about an update of what we're seeing with the schools. So as you remember, the Erie County Health Department is working very closely with our schools from pre-K to grade 12. You remember in the beginning of the year, we took a very conservative approach to isolation and quarantine, where if there was somebody who tested positive in a classroom that lasted over 60 minutes, we were concerned about potential exposure and spread within the classroom and then throughout the school. So what we decided to do, is based on some literature search, is to make sure that the whole classroom was quarantined for 14 days if they were together for over 60 minutes. So we looked at our data from the Erie County Health Department and reevaluated this policy, and we found that, since during that 14-day quarantine period, people in the classroom weren't popping up as positive, and we felt that policy could be revised and still be safe for the school. So what we did is we eliminated the rule for people having to be in quarantine if they were in the same class for 60 minutes or more. And now for the school, inside the school, we are going with just the regular guidelines as for quarantine and close contact definition as we use for the community. So a close contact in the community and in the school is for somebody who was within 6 feet of a case during their infectious period for 10 minutes or more. So that is really, I think, helping the schools to offer in-person classrooms if they're able to do that. So each case is individual, and we take every case on its unique situation. So there could be circumstances where we might quarantine more than just the people who are within 6 feet for 10 minutes or more, based on the duration of the contact, the proximity, and also if the case was symptomatic or not. So you can imagine if a case was like hacking, coughing, we might be more aggressive about quarantine than compared to if the case was asymptomatic. So again, we want to keep everybody safe. So these are data looking at the cases that we have been reported to us among students and staff in the schools, starting from the beginning of October. So you can see that the number of cases that we see reported really mimics the positivity that we're seeing in the community, where we saw a high in the end of November, and then we've started to see we just have that next week, that last week in November, first week in December, we started to see a decline, just like we saw a decline in the positivity rates and the numbers in our general community. And so far, as of Thursday morning, we've had 99 cases among Erie County school students or staff. So again, we're hoping we'll start to continue to see a downward trend. Looking at what we have been seeing from the schools that are doing their own testing in the schools, their testing programs, and reporting to the New York State Health Department. So there are a few school districts that have been on board already and have a robust testing program. And so that includes Akron, Alden, Amherst, Clarence, Hamburg, Holland, Lakeshore, Lancaster, Tonawanda City, and Williamsville in alphabetical order. And so over the past 2 weeks, there have been almost 4,000 tests reported from these school districts. And of those, only 17 were positive. So that is a positivity rate of only 0.4%. So then, again, that confirms that the classrooms are a safe place to be. We're not seeing huge outbreaks in the schools. The schools have really strong policies, making sure that people are symptomatic, stay out of the schools, and until they can get evaluated by a healthcare provider and or a test, and we're really not seeing transmission in the school. So schools are a safe place, and we hope we can work with more school districts to make sure more in-person learning is available to as many students as possible, because really that's a great opportunity for students to learn and also provide them with social emotional support. So just want to remind people of just what we need to do to keep our numbers down. Remember, we were able to avoid that post-Thanksgiving bulge, and hopefully we'll be able to avoid any type of bulge after the holidays with Christmas and New Year. We know people want to get together, so we just want to keep our numbers down. So just some simple things, going to say it one more time: stay home if you are sick. Just stay at home, except to go out to get a drive-through test or an in-person test, but you want to get a test, but just otherwise stay at home. Don't go to school, don't go to work, just stay at home and stay in your own room. Don't affect the other people in your household. Also, avoid any in-person gatherings. We know in the summers our numbers were low because people were able to gather outside because that is a lower risk. We know that. It's difficult to do that now. Maybe if you're skiing, you could do that, but it's cold outside, and so everybody's going inside to gathering where we know that transmission is very, very easily done. So we want to avoid that transmission, so please avoid any in-person gatherings with people that you don't already live with. And please, try to refrain from traveling. We know that that other states have very high rates, and it's not, it's not just the planes and trains and buses where you're at risk of getting infected. It's the airports. The CDC has reported that people are getting infected in the airport. So just even getting onto the plane or getting off the plane is putting yourself at risk for transmission. So if you do have to go out, please wear a face mask. We know that face masks are very powerful. I mean, we've had instances that I know of anecdotally where there have been people that are positive in a workplace, and when we do the investigations, we see that they had strong policies in that workplace where everybody was wearing a mask, and we didn't see any transmission within the workplace. So please wear a mask. It's a powerful tool for prevention. And also, if you can, keep your distance. Remember, we want to social distance more than 6 feet apart. Don't let those little droplets of saliva or whatever when you're talking spread. And 6 feet is usually in kind of normal climate is where the distance that it can go. And also, wash your hands. Listen to your mother. Wash your hands with soap and water. So just want to remind people that we cannot test our way out of this pandemic. So we know that a test will tell us at the point of time when you had the specimen collection if the test was able to detect virus, either the RNA if you have a PCR test, or a protein if you had an antigen test. And there we've seen plenty of examples, and I'm sure many of you have experienced them, even lived them, where somebody has they get infected from some type of get together where they're or just going out and they don't even realize they were infected at work or wherever. They feel well. They know that they're going to get together with friends or family, so right beforehand they get a test. The test, and it's only maybe 3 or 4 or 5 days, after their exposure, the test is negative. So they're like, hey, I'm good. I can get together with my family. So they get together with a group. They're asymptomatic and they're still transmitting. And then, say a day or two later, they develop symptoms and they get a test and they realize they were positive, and they expose the whole group because they were sitting close together. They were eating and drinking. Of course, you can't wear a mask when you're doing that. So please think twice about getting together for the holidays in person. This year we're asking you to make it a little bit different than other years and celebrate just with the people in person in your household and have a great big cross-country global celebration, which is virtual, with all your other friends and family that you don't usually get to see. So virtual is important. So next year we can get together with everybody after we're all immunized and we're all able to get over the hump of our pandemic. So just want to give people some information about our new COVID-19 hotline. hours. We also looked at, we made some evidence-based changes to our hours, looking at the times that people are calling. So as of this Monday, December 21st, we're changing our weekday hours of our call center from 8 a.m. to 6 p.m. On Saturdays, we're going to be open and answering phones from 9 a.m. to 12 p.m. And then Sundays, we are going to be closed. Over the holidays, we're going to have shortened hours to respect people so they can get together with people in their household and celebrate the holidays. So Thursday, we're going to have a shortened hours of Thursday, December 24th. Christmas Eve, we're going to have shortened hours from 8 a.m. to 12 p.m. Friday, Christmas Day, the 25th, we're going to be closed. Then the following week for New Year's Eve Day, we're going to have shortened hours from 8 a.m. to 12 p.m. And then on January 1st, New Year's Day, we are going to be closed. So remember, the call center, getting information, scheduling a test, so those hours are changing. So finally, I just want to reach out and say thank you to Erie County. For Erie County government and especially the health department, it's been a really tough 9 months. We've worked very, very hard. And I can tell you, personally, the past couple weeks, it's been very stressful, not only because of the increased number of cases, but the health department, my staff has been attacked, and I've been personally verbally attacked on social media and other platforms, and people coming to my house at Thanksgiving Day to protest, and it's been very distressing. And and they've made really negative comments about my heritage, and it's been really frustrating. And our county executive was brave and stood up and called it out. And now the rest of the community is being brave and calling it out, and just letting me know and letting the health department know that they support us. And we've received really supportive emails and written snail mail notes and in emails, and just a lot of and really supportive messages on social media. Even got some flowers the other day. So I just want to say I really, really appreciate that. We all in Erie County, we appreciate your support, and we're so glad that you're speaking up and showing your support, and for the government and our health department keeping everybody healthy. So we really appreciate this feedback and the positive messages, and I can't tell you how much it means to me and how much it means to the health department and to the government. And so we just want to wish you happy holidays, last day of Hanukkah, and I know that the Christmas and other holidays are coming up, so just want to wish you a happy holiday, and thank you so much for all your support. So I will turn it over to our county executive to entertain questions.
Thank you, Dr. Burstein, and I want to thank those members of the public who've rightly commented positively, and thanking the members of the Department of Health staff, as well as our good doctor, for the work they've done, because I see what they do, and they've worked tremendously throughout this, and thank you for the public for those kind comments. We intend to have a press briefing next Monday. I do not believe we will have another one unless conditions warrant as a result of the holiday week. So we will be having a press briefing next Monday. After that, we will update on social media pages, the Department of Health's pages and the like. And if there was a reason to have another press briefing, we would, but it would only be based on conditions so changing. And at this point, we just start planning on Monday. So with that, I'll open it up to questions, and we'll start with the B News, Ethan Powers.
Hey, Mark. Thanks for taking questions. Just wanted to get your perspective on the coming stimulus package as talks continue in Congress. It seems right now like the implication is that direct aid to citizens and aid to localities might be something that's mutually exclusive. So with the absence of any more state or local aid, can you just talk about the anticipated effects that might have on the county? I mean, for example, what was was the county in any way relying on more aid in any way to assist with the vaccine distribution?
Well, I'm very disappointed to see the direction that the negotiations have gone in Washington. They should have passed another care package, so to speak, months ago. It appears they will not be assisting local governments that are the front lines. We have the testing clinics. We'll be helping to deliver vaccine to the general public. It's very disappointing to see that from Washington. That was, I guess, not totally surprising after everything we've seen over these last number of years. We have $20 million set aside in the 2021 budget to assist for COVID-19 response, which would be the general COVID-19 response like we've been doing, testing, helping out with the costs associated with contact tracing and the like. And we're also going to have additional costs associated with vaccine delivery. We don't know exactly what those costs are. The care package, this new round that the federal government is announcing, it does sound like it will include some funding for vaccine delivery, but it doesn't sound like it'll go directly to local government, so I'm not exactly certain if we'll get any assistance. We're in a tough situation. We've done a very good job of managing our budget so that Erie counties will end up 2020 with a tiny surplus, like $500,000. Normally our surpluses are in the $10 million range when you're talking about a $1.5 billion or greater budget. So I want to commend the budget office for the work that they've done to balance the budget this year, as well as the department heads and other elected officials who helped contribute to savings. It's been a tough year, but we got through it. And next year hasn't even started yet, and we're already concerned about how we're going to pay for things. And I'm hopeful that the federal government will realize they need to fund the front lines. WBEN, Mike Baggerman.
Hey, Mark, can you hear me all right?
I can, Michael. Go ahead.
Okay. I'd love to get your perspective on this interesting concept that's come my way today. With a lot of frontline workers getting vaccinated, what are your thoughts on the possibility of frontline healthcare workers who are vaccinated being able to go to that Bills home playoff game potentially in 3 weeks? I mean, it would be possible since January 9th is more than 3 weeks away, and many of these doctors and nurses would have both doses of the vaccine that's required. What's your thoughts on it being a possibility of happening, and what would go into it?
That's the first I've heard of it. I've heard nothing to that regard. And once again, New York State would have to allow people in the stands because, as we noted, having the vaccine may protect you from getting sick, but it does not appear, at least to this point, it may stop you from being a carrier. So that is a concern. And I do not believe that the football team would be eligible for first-round vaccines. They certainly would not at this point. But I don't think there's any discussion at this point, as we are still in an orange zone in Erie County. I'm hopeful we'll get down to a yellow zone soon, but we still might be a couple weeks away. I think we've gotten through the Thanksgiving bump. There are other areas in New York State that are actually doing worse than we are right now. So let's just keep heading on the trend that we are, and we'll consider it as we come due. But it's the first I've heard of it, and once again, unfortunately the vaccine, well, I should say, fortunately, it appears the vaccine will protect you from getting sick, but it may not protect you from being a carrier and transmitting it to others. WBFO, Kyle Mackey.
Yes, hi, thank you for taking my question. Can you hear me?
Yes, I can.
Okay, great. So I would like to know, is the county tracking the total number of vaccines being administered? And do we have enough in the region to cover, the first wave of frontline medical workers and, residents of long-term care facilities?
We do not even know how much vaccine has been delivered to our region. You'd have to contact New York State for that information. They are tracking it. My understanding is they're monitoring every dose that's being administered through the New York State Department of Health. But the vaccines have not come to Erie County, as I've said. The vaccine went directly from from New York State to the hospitals. So I don't even have a good number as to how many exactly were received on any one day and administered. New York State does.
Okay, and just wondering, anecdotally, have you heard anything? We've been hearing some reports of extra doses being included in the Pfizer vaccines. Have you heard anything like that happening here in Western New York?
I have not. It's not to say it couldn't have happened, but I have not. We've dealt with some issues. For example, ECMC's doses were not sent to ECMC. They were sent to Millard Fillmore Suburban and Olean General. I have no idea why. Myself and the Lieutenant Governor have been working with New York State to try to ensure that that never happens again. So ECMC did not get direct delivery of doses. They went to Millard Fillmore Suburban Hospital, which is a Kaleida hospital, still in Erie County. Not in the immediate vicinity of ECMC, but at least if you got a car, you can get there. But we did hear that a portion of ECMC's doses went to Olean General, which is an hour and a half drive away on a good day, nevertheless, if it's snowing out. So we're working on those issues, and we're trying to deal with New York State, who actually was doing the delivery, as to why that happened. Sandra Tan, Buffalo News. Sandy, are you there? Unmute your line if you're talking. If not, we'll move on to Spectrum News. Anyone from Spectrum News on? Spectrum?
Yes. Hi, Mark. Thanks.
Sandy, are you there?
Can you hear me?
Unmute your line if you're talking.
Let me see.
We can hear you now, Sandra.
Can you hear me?
Yes?
Hello?
You're barely audible. Why don't we try to figure out what's going on with you? We'll come back to you. Steve Brown, Channel 2.
Yeah, thank you. Question. Early on during the pandemic, there was a great deal of attention about the increased amount of virus spread in communities of color. And that topic has kind of resurfaced with talk about the equitable distribution of vaccines. So I was curious to know if there is data that continues to show that the virus may be hitting communities of color within the region harder than other areas. Because again, there's been a lot of discussion from the governor, from the chairman, or excuse me, the president of Catholic Health about making sure that distribution of the vaccine is equitable. So I'm wondering what the data says about current spread of the virus within communities of color.
Actually, the most recent data shows that it is not the impact it was early on. Communities of color were certainly impacted at a much greater degree early on, at higher rates of infection as well as higher rates of death than they should. Actually, as of the most recent data, African Americans made up 14.3% of all deaths. They make up 14.6% of the population, so it's actually less than the population percentage now, not much, but less, and it was earlier around 20%. Earlier, I did have this week earlier a conversation with some of the key members of the Health Equity Task Force, the Ignite Health Equity Task Force, including Dr. Underwood, as well as Reverends Pointer and Nicholas and other partners of theirs to talk about these issues. We certainly know that it's an important aspect. Dr. Burstein is working with a couple others right now and forming a advisory task group, which will be made up of members of the medical community, including members of the African American and other peoples of color community. So we want people to understand that, number one, the vaccine's not going to be available to the general public for months. So we do have some time to work on this and make certain we get our ducks in a row, so to speak. But we have seen in the most recent times that the more cases are actually occurring among whites, suburban whites, and rural whites. And as a result, you've seen growth in not only hospitalizations, but deaths among individuals who live outside of the city of Buffalo, much more than we saw early on. And it's just sad because we know it could have been prevented if people had taken the right measures. We've worked very hard with the Ignite Hope, Ignite Health Task Force for months on a number of initiatives to protect the public. I want to thank them. I want to thank everyone else who's played a role. There's so many other people who've played a role, from the healthcare community to even citizens just distributing masks. I want to thank them all for their good work over these past, well, not full 9 months, but let's say 7 months to address this issue, and it has made a difference. We are one of the few parts of the country where we're not seeing this ridiculous differential than what you would normally see based on your population broken down by the races. Chris Horvatis, Channel 4.
Hey, Mark. So Erie County is working on a vaccination plan, and we now know Catholic Health is working on a vaccination plan on behalf of the 5-county Western New York region. How do those two plans coincide with each other and work hand in hand? Is that known yet, or is that something that has to be worked out over the next few weeks and months?
Well, the problem that people are focusing on is like I said, we didn't think we were going to be involved in the first round, which was regards to hospitals and nursing homes. We were told we weren't, but we were going to be involved in the general public. We know there's no way that Catholic Health can administer the doses for the general public, nor do we believe that they're going to be the final recipient for all these doses. They may be the middleman, so to speak, from New York State to Western New York, and then distribute it out. Because we're talking about hundreds and hundreds of thousands of doses in the future as we inoculate and vaccinate the general public. So having had conversations with New York State, we were told you are going to be the ones that are going to be primarily responsible with your partners to administer for the general public in the future. Catholic Health has been, like all the other hospital systems that were identified for regions, as being hubs for reception of the vaccine for what would be considered phase 1 and parts of phase 2. They are not going to be the only provider of vaccine when we're delivering vaccine for the general public. They can't. They don't have the capability of doing that. As much as we have good partners at Catholic Health, they do not have the capability of doing it. We're going to be working together as a community to do that. And as I said, we've talked for a long time now that we're going to be partnering with many other people with regards to vaccine delivery. And that's how it's going to happen, is everyone's going to be involved, including the other hospital systems, the community healthcare organizations, the University of Buffalo. So many partners need to be a part of this, including doctors' offices that provide vaccines. They had until the 18th to apply. I think it was the 18th. Yeah, 18th in New York State to apply to the New York State Department of Health to be an administrator of the vaccine. So any statement by other parties that they're the sole provider of it is incorrect. I think it's fair to say everyone's going to be involved. But just a final portion of that question is New York State said, Erie County, all the counties, Chautauqua County, Cattaraugus County, and the like, you're going to be responsible for ensuring your public gets vaccinated. So we all have a role. Channel 7.
Hi, this is Hannah Bueller. I have a question as it relates to the contact tracing. I understand, last month you were in dire need for contact tracers. You have since, it looks like at 98, doubled what it was in November. Is there any plan in place to have contact tracers as a full-time position in Erie County so that there is not another shortage in the future?
Well, contact tracers in Erie County are some of them, actually almost all of them, are full-time employees, but they're working out of title for some of these folks. Some of these folks are from the sheriff's office. Some of these folks are from the Department of Social Services, where they actually have another job that they're normally supposed to be doing. Right now, we don't have any money to create new jobs. Simple as that. Federal government's CARES Act money is come and gone. So I can't go out there and spend money I don't have. So we're utilizing the resources that we have. With regards to contact tracers, we're all caught up on cases. We have, as you noted, nearly 100 contact tracers, 98 is the number, working as we speak, and we are in a pretty good position going forward. You would only keep contact tracers around for as long as you have these types of high numbers and viruses. We're going to have contact tracers probably for the upcoming year, until we can get everyone vaccinated. But for the time being, we're utilizing resources that we already have. We do not plan on creating new jobs to do that. Go back to Sandra. Are you still there? Can you speak, Sandra?
I'm here. Can you hear me now?
Yes, I can hear you.
All right. So my question is, in light of the fact that we seem to have leveled off and are even showing some signs of declines in terms of hospitalization, and as you yourself mentioned, there are other parts of the state that now have higher hospitalization rates than we do. Can you elaborate more on any conversations you're having about us possibly, with the state, about us possibly rolling back to a yellow zone? You said maybe in a couple of weeks. I'm just curious to know what those conversations with the state have been like, and whether or not there's any openness for them to upgrade us to back to a yellow zone.
Well, the conversations we had have been more revolving around, thank God you're not in the red.
Right.
Because we were seeing a spike. As Dr. Burstein noted, the evidence shows that we still might see a spike in hospitalizations up to around 500 in mid-January. So for now, it would be nice if we were rolled back to the yellow. I think we're going to have to probably wait a couple more weeks to see if that happens as we get through Christmas. Because it's fair to say that at this time, the question you were asking me wasn't whether we were going to be rolled back last week. It was, are we going to be moved to the red? We seem to have survived the Thanksgiving surge. There was an increase in cases. There was an increase in hospitalizations, but not to the rate that we've seen elsewhere, or for that matter, like we're seeing just to the east in the Finger Lakes, where they actually were worse than us at our peak. So for now, I'm hoping that if we continue to go down, the state will take that into account so that we could go back to the yellow, which of course would allow for the opening of indoor dining and some other aspects that you could increase the capacity of. But I'd be shocked if that happened in the next week or two, just because of the Christmas holiday and the worry about what that might bring.
Thanks.
Okay, going back to Ethan Powers. Do you have any more questions, Ethan?
I do, Mark, thanks. Actually, a question for Dr. Burstein. Just a quick follow-up, Doctor, to the promising data you showed in relation earlier to the very low positivity rate in school buildings. We've seen this week many districts return to their hybrid instructional model. Others have opted to postpone that return until after the new year, some citing spikes in communal spread in those respective zip codes. In your expert opinion as a pediatrician and as someone who has really dug into the data for transmission inside of schools, is the recommendation at this point that school districts return to a hybrid model regardless of ups and downs in community spread?
Well, I'm stuck with my mask. Oh, there I go. What we're recommending is that based on data to show that there is very little transmission within the classrooms, and much of that transmission is actually among staff when they're not adhering to school policy with wearing masks and and staying close together for a long, prolonged period of time. So we're really not seeing transmission within the classroom, especially from student to student. That if the schools feel that they are, able to undertake bringing people back and implementing a strong testing program, that I hope that they feel comfortable doing that. But every school is different, and I'm not in their shoes, and I don't know what their circumstances are. But I feel just in terms of what we know, and with policies that schools are able to adopt and enforce, that school is a safe place for students and for either learning in person 5 days a week or whatever hybrid model the schools can accommodate because of their population size. But I hope that as many schools as possible feel that they're able to open up the classrooms to in-person learning really benefit the students both educationally and also with social and emotional support, and also help the parents when they have to work. Thanks.
Okay, Mike Baggerman, WBN. Any more questions, Michael?
Yes. How worried are you that there will be more people that want to congregate for Christmas gatherings this year, knowing that the Thanksgiving cases wasn't as bad as health officials thought it would be?
Well, let me preface that question by saying one of the reasons we think the Thanksgiving surge was not as bad as it could have been is because people stayed among their own internal family groups. We did get lots of reports of individuals through our contact tracers and from the hospitals who were sick, had to be hospitalized, and did attend Thanksgiving in a gathering outside of their own home group, so to speak, their family. So what our fear is, of course, is as people look and say, well, we got through Thanksgiving, okay, so I can go visit Aunt Jenny now. You're still putting yourself and Aunt Jenny at risk. So it's going to be a tough one. We know people want to be with their family on Christmas. We know people are going to definitely want to be in church on Christmas or Christmas Eve. It's a tough situation, but we're asking people once again to avoid these small gatherings outside of your own family unit, so to speak, or the individuals that you spend all the day with, because that's how you spread it. And I really thank the people of Erie County for following what we were suggesting for Thanksgiving. It made a difference. We did see a spike. It wasn't as bad as it could have been, or truthfully as bad as we're seeing in other parts of New York State right now, where they're really dealing with that spike from Thanksgiving. So thank you to the people of Erie County and Western New York who listened, and we're asking for the same. We know it's not going to be easy, but we do it this year so we can get through this year, protect our loved ones, so that next year we can all be together. Kyle Mackey, WBFO.
Yes, thank you. I'd like to ask another follow-up question on schools. And of course, the largest school district in the area, Buffalo, has been fully remote since March. And at his last press conference last week, Superintendent Dr. Cash said there's just no way that such a large, complex district like Buffalo would be able to meet the testing requirements that many smaller suburban districts, outside of the city have been able to meet to get students back into school buildings. Many parents are, this is a huge burden, we know, on families, on students. So my question is, should the county be doing more? Is it possible for the county to be doing more to try and help Buffalo get back to a hybrid model before February 1st?
Well, we certainly can't do more testing. We are basically tested out. As the doctor said, we're telling people, if you make an appointment, please show, because we have so much demand. If we were to try to help the city of school district, we'd have to eliminate all the testing that we do, and also they'd still have to do more. We can provide them free Binax Now testing kits from the Abbott Labs. We have those. We're providing them to the school districts. New York State has been giving us a good flow on that. We certainly can provide that to the school district. I'm very worried about what's going to happen come January. We created virtual learning centers. The county put $15 million of CARES Act funding in for the virtual learning centers across Erie County. That money runs out. There's no money for those virtual learning centers as of January. I told Superintendent Cash that early last week. And I'm very worried what's going to happen to those students. There's thousands of students countywide who rely on the virtual learning center because their parents have to put them there rather than stay home because they're not in school. It is a legitimate concern. We thought that the schools would be open. All of them would be open post the Christmas break. The CARES Act funding only allows us to spend it through December 30th. I do not have additional money to put in for the virtual learning centers across the county. It is a concern. We do know that more parents can qualify for child care assistance than are presently seeking from Erie County, and we still have that child care assistance available. But I am concerned. I think we all realize that the data shows that if it's done properly, that's the thing, if it's done properly, you could make the school environment safe. No environment can be 100% safe. And so that's why I don't begrudge any of the decisions that are being made by the school district superintendents and the rest. I understand they have difficult decisions. No place in the world can be made 100% safe. You can make it very safe by wearing masks and having proper protocols in place. So I'm very worried about what's going to happen in the future, especially with those students that are relying on the virtual learning centers because their parents have to work and the school district is not open, but they need to learn. So that is a concern of mine, as well as many others. Our Deputy County Executive, Maria White's been working on that topic for a while now. And that's why this lack of federal funding is huge. Because if we had gotten a commitment from the federal government that we were going to get another $60 or $70 million in aid, we could have put that money into virtual learning centers going forward. But with no federal money, no virtual learning centers. No additional back to business programs from Erie County. We've just got we've got limited dollars, and they're going to be spent on the COVID-19 direct response and eventually vaccinations. Spectrum News? None today. Okay, Steve Brown, Channel 2. Any more questions?
Yeah, just one quick one. Did I hear you correctly that the back to business report coming from 43 North might be weeks away?
Well, I think it's due January, like the first or second week of January, so that technically is weeks away. They're finalizing it. I've been told it's pretty close, but the report is due to the legislature, I think January 15th, but we'll check on that. Chris Servatis?
Yeah, the number of deaths, you're right, it's sobering. It's somber that we passed 10,000 like you referenced. We get an email from the governor's office every day, and it lists deaths by county. And going back weeks, most days with very few exceptions, Erie County has the most deaths. And that includes the New York City boroughs, even, which of course.
You're coming in and out, Chris. I don't know what's going on, but I understand the gist of your question.
Yeah, what do you think the reasoning is for just why Erie County surpassed other counties and deaths over the past several weeks, months?
Well, we were number one when it came to new cases. It's as simple as that. As we've said all along, first come the cases, then come the hospitalization, then comes the deaths. We've seen deaths in hospital settings. We also see deaths in nursing homes. I get the report on a daily basis. It's called the HERDS report. It's a hospitalization report from New York State, which includes there's 3 different reports, actually. They all come at once. One's the hospitals, one's the nursing homes, one's the assisted living facilities. Dr. Burstein gets that. A number of us get it. And it'll show how many people died on a particular day in the hospital setting. The one will be nursing homes. The one will be assisted living. We can never guarantee if it says in a hospital that that person is an Erie County resident. They could have been a resident of another county, often are. But the nursing homes, those are generally residents of Erie County, and it's very sobering to see 5 deaths on a day in a hospital, but 8 in a nursing home. And remember, most nursing homes are still closed to the public. There's people who want to open up nursing homes to the general public so they can visit their family members. I understand the reason why. We'd have dozens and dozens of more deaths if that's the case. Because almost all of these new cases in nursing homes are coming in from an asymptomatic staff member. It's really sad. But it really comes down to, for a month and a half, maybe more, we were the number 1 area of New York State with regards to new cases, the growth in cases, the highest percentage of new cases, the highest number of hospitalizations, and that's finally leveled off. I would not be surprised to see in the next few weeks, because some of the other areas of New York State have very high caseloads, much higher than we do now, that they take over this somber number 1 position, which is the most deaths on any one day by region. I just saw something this morning on Facebook where, and I won't say the names because I don't know if the family wants it to be said, but I know a little over a week ago, or about a week ago, the wife passed. And I just saw yesterday night late that the husband of the wife who passed of COVID just died of COVID himself. And these were not very old people. These were not people in nursing homes. And it just breaks my heart, because these are not, the individuals who passed were not close friends or family of myself, but I know these people who lost loved ones. And I know the pain from talking to them or reading their posts that they're going through. And this is preventable if people act in the best manner possible, which is wear a mask and avoid small gatherings. Nursing homes are a whole nother level that is very concerning because of the frailty of the individuals there. But we just got over this 1,000 deaths in Erie County, which is something I hoped we didn't hit, but we did. It's basically 3% of all confirmed cases that we have in Erie County, the individuals have died. Now, we know there's more individuals who actually had COVID-19 than we've confirmed, but more than 1,000 people have died in Erie County in 9 months as a result of a virus. I would have thought we could have done better. You can point the finger at many different things. You can point the finger at Erie County government. Did we do a better job? Maybe, maybe not. Could we have, I should say. But it's just sad, because those are lives. Those are people. They're just not just statistics. It's not just a number on a page. It's someone's mother. It's someone's sister or brother. It's a grandparent. It's a son or a daughter. We've had people under 50 die. So when we talk about that 1,001 deaths, those are 1,001 individuals who on January 1st or New Year's Eve this past year were maybe ringing in the new year, hoping that 2020 would be a great year, with wonderful plans ahead of what they were going to do with their family and their loved ones. And they're not here with us anymore. It shouldn't have happened. It did. We need to do our best going forward so that number stays as low as possible until we have a vaccine that can protect us all. Channel 7. If not, Sandra, do you have any more questions? You get the last one.
You mostly answered the question I was going to ask, but I am curious to know if you expected we would be here at more than 1,000 deaths before the end of 2020?
The answer is kind of, early on, I was very worried that we'd be in this position because of the statistics and the projections. I had a number on my desk that was what would happen if 50% of Erie County tested positive during this year. Based on the death rate that was coming out of China and Italy, how many people would die in Erie County, and it was over 6,000. So looking as it is now, I mean, we were worried that we could have 6,000 people if half of Erie County's population got COVID-19. Thankfully, we didn't get that high. I was hoping it would be the lowest number possible, but I can't stand here and say that we only had 1,001. That's great because we were projecting 6,000. We really, I was hoping that we could save every life possible, and I still am. 50% of our population has not gotten sick. If the current death rate is accurate, around 3%, okay, let's just even split that in half and say it's 1.5% is the death rate, as compared to we know 3% of those who we have confirmed cases have died. Let's just say it's 1.5%. That's still thousands of individuals who would die in our community if another 20 to 30% of our population caught it. And that's why we just need to do our best to avoid that scenario by wearing our masks and avoiding small gatherings as much as possible. We were lucky in the summer. We didn't see the spread like we could have seen in the summer, primarily because it's open air or outdoors. People were doing well. Now we're indoors. We're seeing a lot of the continued spread through gatherings, and the statistics are numbers, but there are people behind the numbers. And I hate to say it, but there's someone who's probably watching this right now who's not COVID-19 positive, who will catch the illness and probably die before they can get a vaccine. The statistics just say that is the case. So let's do what we can as a community to ensure that we protect as many people possible from getting sick in the first place. Because if we can protect them from getting COVID-19, catching the coronavirus, we can keep them alive. It's as simple as that. So with that, I thank all the media for your questions. As I said, we will have a media briefing and a briefing to the public on Monday, probably at the normal time. I do not believe we would have another briefing the remainder of that week because of the holiday week. I certainly want to wish all our friends in the Jewish faith a happy Hanukkah on the final day of Hanukkah. Getting very close to Christmas, of course. Santa will be arriving. Our Department of Homeland Security and Emergency Services will be keeping track of NORAD Santa to make certain that Santa arrives safely, but he always does. Santa, he's got magic. He knows how to do it. So we'll be watching that as we move along next week. Just one final thing for those maybe watching. Our parks are open for outdoor activities, including sledding. I believe sledding is available right now at Spraguebrook Park. The casinos will be open for bathroom use only. You cannot go in, have hot cocoa, sit around the fire. The fireplaces will not be on. They will be partitioned off to allow people to use the restrooms. So if you go cross-country skiing, if you go snowmobilers, a lot of snowmobilers pass through our parks. If you're just going for a run, hanging out with people, you can do that in the parks. The bathrooms will be open. Our sled hills will be open. New York State has allowed outdoor skating without games, just as you can skate on a sheet of ice. And they're doing that at some New York State parks. We're going to try to do that at a couple of our parks. So if you want to get out and enjoy the parks, please do that. But we're going to avoid the interior gatherings because all the buildings will be closed otherwise, except for the use of the bathrooms. With that, until I see you next Monday, be safe and well all. Happy holidays to all. Merry Christmas very soon. Happy Hanukkah. And just let's do our best to protect our fellow residents so that we can all get through this, what is the most joyous season of the year, together. Take care all.